Hi, I'm Jen Gordon, and I have EGPA, a form of ANCA-associated vasculitis.
Hi, and I'm Mitch Horowitz. I have MPA, and I'm a registered pharmacist.
We're here today to talk about things to help when you're prescribed medications for vasculitis. Here's a pro tip. Ask the pharmacist. Mitch, you're a pharmacist yourself, as well as someone living with vasculitis. Let's talk about that.
Yes, it's very important that when you pick up your medications at the pharmacy, you ask the pharmacist questions. You could even ask the same ones you asked your doctor. Hopefully you will get the same information. But this is the basics of what I would ask. I would ask, what time of day should I take this medication? Should I take it before meals, after meals? And we could say on an empty stomach. So an empty stomach is considered 1 hour, at least 1 hour prior to eating, or 2 hours after eating. So that's something to keep in mind. Some medications are better absorbed on an empty stomach. Also, there are food interactions. A very common one is with dairy products like milk. I know a lot of people like to take their medication with a glass of milk instead of a glass of water, but that could actually be problematic. The calcium in all the dairy products interacts with some medications. Same thing with iron tablets. Sometimes medications will be interacting with iron tablets, and the iron binds with the medication, and it's not absorbed into your body. Also, you want to know about where to store the drug. I always would tell patients to keep their medication in the kitchen if they can. Not everybody wants to keep it in the kitchen. Maybe there's too much access for children. But the last place we recommend is where everybody likes to keep it, which is the medicine cabinet in the bathroom. And that's because people take hot showers, the humidity in the air. It's possible that it would get in and affect the medication. And then you also want to check about side effects, what side effects to look for. Also, what's a mild side effect as opposed to a severe side effect. So sometimes you might just get a little dizzy standing up too fast. But if you feel like you're going to pass out, that's vastly different. But you should ask the physician what to expect in terms of things like that. You may have to discontinue taking a medication. You may have to have a dose change.
Great. Mitch, I'm wondering, since you're a pharmacist, how has that helped you in your vasculitis journey?
Well, as someone who worked in hospitals for a long time, I had a lot of interactions with doctors of all levels of education. So I learned how to diplomatically but firmly discuss with physicians things that I thought that they might be doing wrong or they could be doing better with medications. I have no problem telling a doctor I disagree with them. And if you feel that there's something that you don't like about what they're doing with you, don't be afraid to ask them to justify it or to explain it better. Is it really worth all this hassle? And sometimes you'll have a better outcome like that. For myself, I never had any problem. If I felt a physician was doing something that I thought wasn't in the best interest of the patient, sometimes that's myself, I would say something. So if a physician gets an attitude with you, you've got the wrong physician.
That's a great point. And knowledge is power and gives you the confidence.
Right. And that's why I advise people to read everything you can about your type of vasculitis and the medications you're taking. And always be sure you're going to a reliable source. So there are a lot of things on the internet, places on the internet where you get opinions from other patients, which is not the same as going to a place like the Vasculitis Foundation web pages or actual medical information sources, some of which are accessible to people even though they're not in the health profession.
Or go straight to the pharmacist.
Yes.
Right.
Yeah, always go. You can always go to the pharmacist. And if I didn't mention before, if possible, try to work with just one pharmacy so that they know all the meds you're taking. They have software to keep track of any drug interactions that you might have. If you've gone to several different doctors, the doctors don't necessarily know what the other doctors have prescribed, but the pharmacy, if you stay with one pharmacy, they will.
So if you go down to your local pharmacy, do you think the pharmacist wants to talk to you?
Well, in New York State, which is where I practice, it's mandated that if you ask to speak to the pharmacist, they have to come over and talk to you. So I always enjoyed speaking with people. I'm a social guy, and I never had any issues with talking directly to patients. And I think most pharmacists are like that.
Yeah, I found the same thing. I think they really are there to help. And it's probably one of the more rewarding experiences for them to directly interact with people about their health.
Mm-hmm.
Thank you. That was a lot of great information. Thanks, Mitch.
Okay, thank you.